And fellow classmates, and dependent upon your time zone and chosen viewing time, good morning, afternoon, and evening. My name is Julia Hines, and this presentation will lay out my teaching plan proposal for a population of patients contending with chronic non-malignant pain. This presentation will begin with an introduction to the background of the proposed teaching plan for the target population, namely adult patients contending with chronic non-malignant pain, and the healthcare organization within which they seek and receive care and education. Next, the discussion will turn to the reasons for the educational intervention, given the results obtained through various assessments of the identified problem. Then the presentation will explore the evidence-based educational best practices found in the current literature, followed by the proposed teaching plan and expected learning outcomes. Finally, this presentation will end with a summary conclusion. To begin, a few preliminary definitions are necessary. Pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage. Chronic non-malignant pain, or CNMP, is pain that on average continues 3 months or longer, persisting continuously or episodically after the original injury or damage is healed, and often without a definitively known cause or etiology. Once considered a symptom, CNMP is now classified as an independent diagnosis. The effect of CNMP is ubiquitous, impacting all areas of a patient's life: mentally, spiritually, physically, psychologically, interpersonally, and professionally. The second introductory element to this proposal is the healthcare organization in which intervention will take place: Kaiser Permanente East Bay Medical Center. Kaiser's mission is to deliver high-quality, affordable healthcare designed to improve patient health outcomes and overall well-being via its vision of establishing collaborative care partnerships supported by its core values of innovation, accountability, and evidence-based patient-centered care. The purpose of the educational intervention embodies both introductory elements, as indicated in the following project statement: to develop patient educational material designed to increase knowledge and understanding of chronic non-malignant pain, to increase the development of individualized self-care management, and to increase the practice of safe medication administration in adult patients suffering with chronic non-malignant pain. The target patient population is adult patients with CNMP, men and women aged 25 to 65 years, receiving care in the Pinole Medical Office Building Adult and Family Medicine Department at Kaiser Permanente East Bay Medical Center. Despite possessing diverse cultural, ethnic, racial, and religious backgrounds, a common expectation of the eclectic community of the San Francisco Bay Area, this patient population shares a common syndrome of 6 key health identifiers: decreased physical activity, decreased mobility, increased propensity towards obesity, increased propensity towards pain catastrophizing, increased dependence, abuse, and safety issues regarding opioid narcotics, and increased morbidity and mortality rates. These key health identifiers culminate into life interruptions comprised of employment issues, family disruptions, negative health outcomes, and lower quality of life. It is important to note that in addition to documented exacerbation of pre-existing diagnoses, changes in the brain and central nervous system, and pernicious challenges to the cardiovascular system, patients with CNMP are twice as likely to develop suicidality, including suicide completion, as individuals without chronic pain. These data inform the reason for an educational intervention targeting the specific patient population. CNM patients often develop chronic maladaptive neuroplasticity. This is where the noxious, painful stimulus tattoos a pain memory onto the nociceptive pathways or pain pathways in the brain. Patients often develop negative cognitions and emotions regarding their CNMP that feed into the maladaptive plasticity and pain exacerbation events. Given the nature of CNMP management, this patient population is often rife with safety concerns regarding the chronic usage, reliance, and dependence on opioid narcotic analgesia. The poor health outcomes and diminished well-being mentioned in the previous slides form the basis of the need for an education intervention. Surveyed patients revealed a consensus of receiving low-quality patient educational material deficient in inclusive cultural competence and patient-centeredness, understandability, relevance and applicability, helpfulness, and notably inconsistent provision of patient educational material from physicians requested by patients. Surveyed care team members revealed a consensus of a systemic communication breakdown within the care team, resulting in inconsistent practice, an unfavorable perception of the current patient educational material, often opting to forego using it in clinical practice, and the need to transform the current patient educational materials and teaching methodology. Looking at the current situation, the first major barrier is the lack of an interprofessional collaborative care team, or ICCT, combined with the lack of nursing involvement. As indicated in the previous slide, inconsistent practice, knowledge deficits, lack of cultural competence, and the lack of a standardized patient centered approach to teaching translates into a lack of therapeutic patient education. This gap in practice is the progenitor for the gap in knowledge experienced by the target population, where the current disjointed practice keeps the patient in a passive learner role as the mere deposit for data, in lieu of empowering patients and families toward motivated and engaged participation. The gap analysis revealed the stark need for an ICCT with a registered nurse clinician educator at the helm of patient education. Completing an analysis of possible risks to the intervention and a projected cost-benefit ratio, a common thread emerges: the impact of the key stakeholders. The completed top 10 risk register assessment revealed stakeholder buy-in as the main risk theme. Resistance and the lack of motivation, engagement, and desire to participate are the results of time constraints, where primary care providers are allotted a mere 15 to 20 minutes for clinic visits with patients. For patients, the biggest barrier to buy-in is deficient knowledge. This is where the RN clinician educator enters the needs assessment. The cost-benefit analysis revealed the benefits of this intervention outweigh the cost in the long run. Poorly managed CNMP results in skyrocketing costs to the healthcare organization, increased care service utilization, increased access of community resources, negative patient health outcomes, and diminished well-being for patients and families. The value of the intervention resides in the aim for preventative self-care in the home setting. This objective is sustainable over time for both the target population and the healthcare organization, as it aligns with Kaiser's incentive to minimize cost and care resource utilization while simultaneously maximizing preventative care for its members. The teaching plan proposal is also well aligned with the evidence-based educational best practices found in the current literature, which include enlisting an andragogical approach, incorporating motivational interviewing, and integrating the therapeutic alliance model into the education provided to the adult with CNMP. Strategies common to all three best practices include respectful, culturally competent, patient-centered, family-centered education and teaching, establishing a shared decision-making care partnership, and engaging in collaboration that serves to empower patients and families to develop and adopt self-efficacy. Assessment and identification of patients with CNMP trigger the teaching plan. This is the point at which the plan is implemented. A thoughtful discussion about pain, chronic non-malignant pain, and management possibilities is introduced, supplemented by patient educational material that is specific to CNMP and meaningful to the patient's current situation. Patient educational materials, including written hard copy, online, and video, will follow the workflow and be based on the materials provided in the public domain through Oregon Pain Guidance by the Oregon Health Authority. Analogous to the nursing process, this teaching care plan follows the same trajectory of ongoing continuous adjustment and evaluation, where the introduction video would be replaced with additional educational videos on various CNMP topics such as sleep, nutrition, mood mitigation, medication management, activity and light exercise, and managing pain exacerbation episodes. This teaching plan is designed to facilitate a transformative change in the patient's thinking and perception of CNMP. The 5 subject areas of education are CNMP, the role of cognition and emotion, medication safety, self-efficacy, and sustainable self-care management. The key to patient success is motivated patient engagement and empowerment to participate in shared decision-making regarding the creation of his own care plan. The patient learning objectives for this intervention demonstrate actionable steps and behaviors for patients to engage in, providing an opportunity to achieve incremental successes on the path toward care goals. This intervention is the first step in the long journey toward well managed CNMP for the patient. Each objective provides the means to measure and evaluate learning through the required action, allowing for review, remediation, and tailoring. All four learning objectives focus on assisting the patient to develop and adopt self efficacy, to embrace independent self care management of their CNMP, and to assume an active role in restoring autonomy over life, taking back life control from CNMP. In conclusion, the purpose of this intervention is to create and implement patient centered, family centered therapeutic patient education for those suffering with CNMP. Facilitating authentic learning and understanding empowers patients, further cultivating meaningful shared decision making via the establishment of care partnerships. Careful assessment and identification of patients with CNMP, coupled with ongoing screening and tracking, will help patients succeed with developing self efficacy and effective self care measures that improve health outcomes and overall well being. The following 3 slides contain references for this presentation. And I would like to thank you for your attention, for listening, and I'm looking forward to your thoughtful feedback. Have a good rest of your day or evening.